Like Mickey said, I'm a PT here at the Neuroscience Center. I'm also trained in pelvic health, but I would say kind of stroke and pelvic health are probably two of my clinical passions. So I'm excited to share some information with you. I know this topic isn't always exciting and to talk about. So hopefully I can at least teach you some new things or make you feel more comfortable talking about these things.
That's great. It comes up in some of the talks when I visit patients.
Oh,
Not
sure.
frequently, but people who don't have um, people who don't have any. Anyway, they all have issues and
Yeah.
they don't know what's going on, so they're asking questions. So it's great.
Yeah, for sure. These are very common issues after stroke. I think I have in here somewhere like 80 up to 80% of stroke survivors will have some bladder issues at some point in their recovery. Um, so these are just some basic objectives that I hope to kind of get through. So understanding this and understanding stroke and its effect on pelvic health, identifying common pelvic health issues after stroke, learning bladder and bowel management strategies, recognizing certain bladder irritants and norms for the bladder, and then understanding the role of pelvic health rehab. All right, so here's a list of common pelvic health issues following stroke. So bladder and bowel problems are common, and then sexual dysfunction. So bladder problems include urinary incontinence, but also include urinary urgency, frequency, so going more frequent, and then nocturia, which is going frequently at nighttime. Bowel problems include fecal incontinence and constipation. So what is incontinence? It's the body's inability to control the functions of urination or defecation. And like I mentioned, up to 80% of stroke survivors may experience this at some point in their recovery. So after a stroke, the muscles that control urine and stool can be weakened, and this can be a cause of the incontinence. But also depending on the location of the stroke, just kind of that connection between the brain and bladder can be disrupted too. All right, so what are symptoms of incontinence? So urinary incontinence, this is not being able to make it to the toilet in time. So you may have leakage on the way to the bathroom, leaking during everyday activities such as coughing, sneezing, standing up, walking, those types of things, leaking urine without warning, and then wetting the bed during sleep. And then similar with fecal incontinence, this is kind of the symptom of needing to pass stool but unable to make it to the toilet in time or passing it without knowing. So fecal incontinence and diarrhea are typically more common in the early stages after stroke, but then constipation is typically more experienced over time chronically. And we'll talk about that in a few slides. All right. So there are 5 main types of urinary incontinence. Urge urinary incontinence occurs with a sudden urgent need to urinate, with the inability to hold that urine long enough to make it to the toilet. I would say this is probably what I see most commonly. It's sometimes referred to as overactive bladder. Sometimes people will have triggers to this as well, where maybe they're doing dishes and water's running, and that can kind of trigger some urgency or urgent incontinence. Or also like we call it key and door syndrome. Like say you're out at an appointment and you walk in the door and all of a sudden you didn't have to go to the bathroom before, but now you got home, you know the toilet's nearby, and you all of a sudden have a sudden urge. So that would also be included in that urge piece. Stress incontinence is leakage of the bladder when there's increased pressure put on the bladder. So any increase in intra-abdominal pressure. So like with coughing, sneezing, laughing, exertion, those types of things. Mixed incontinence is a combination of urge and stress incontinence. So there's features of both of those. I would say I take back what I said earlier. I probably see this most often. This and then just urge incontinence. Overflow incontinence occurs when the bladder is never fully emptied, and the person with this may feel like they have to urinate all the time. And then functional incontinence, lastly, occurs when a person is unable to recognize the need to urinate or has mobility restrictions that limit the ability to make it to the toilet in time. So also fairly common following stroke with mobility deficits. So these are just some complications of incontinence. They include physical inactivity, emotional distress, embarrassment, anxiety, and even depression, and then intimacy problems. Obviously, it's a very sensitive and personal issue, and if someone's dealing with these things, they may feel like they've lost their dignity. And um, but knowing, I think, bringing this topic to attention and just knowing that there are things out there to help. And I think a lot of the things that do help are very simple and practical. So I think the best thing someone can do if they're dealing with this is just tell their provider and get help. All right, so what do we do to treat it? So of course, pelvic health therapy is going to be first on my list. Um, So in a pelvic health consultation, we discuss the patient's current problems. We'll typically educate on normal bladder functioning, anatomy, and then instruct in bladder retraining strategies. Um, Especially for someone who's suffering from urge incontinence. A lot of the treatment is very behavioral and um, just lifestyle changes are kind of the main things. So we'll instruct in those lifestyle changes, self-management strategies to trial, and then specific exercise tailored to the patient and occasionally manual therapy as indicated. Um, Other coping techniques that we may discuss include wearing clothing that's easy to remove quickly, or wearing disposable continence pads or briefs. There are certain medications and surgical procedures that can be considered as well, but physicians are commonly recommending PT right now as first line treatment. Okay, so now we're kind of shifting gears to nocturia. So we kind of talked about this briefly before, but nocturia is a condition that causes you to wake up frequently during the night to urinate. It's considered nocturia if you're getting up more than twice a night to use the bathroom. It commonly does become worse or more common with age, but there are certain lifestyle changes that can help. Um, some causes of these. So as we get older, our bodies change and our kidneys tend to make more urine at night when we sleep. And then there are certain medical conditions too that can increase urine production. So if you have any swelling or edema in your legs, um, that can increase nocturia. So once a person lies down, that swelling tends to kind of pool more toward and kind of come back up to the bladder. Um, One of the most common reasons for more bedtime trips to the bathroom is drinking too much at night. And then certain beverages, which we consider bladder irritants, can also add to the problem. So we'll talk more about those. I love your water water's the best. Okay, so how can we help control our bladders at night? So first off, reducing bladder irritants and staying hydrated during the day. So limiting fluid intake in the evening. I often will encourage patients to stop drinking fluids about 2 hours before bed as able, unless there's medications that you take before bed, of course, sip water with that, but just don't chug. Um, if a patient is taking a water pill or diuretic for high blood pressure, I encourage them to ask their doctor if they can take that in the morning instead of the evening. Um, and then elevating your legs before bed if you have any edema or swelling can be helpful. All right. So now talking more bladder retraining strategies that we will teach in pelvic health physical therapy. So timed voiding, we'll typically use this if someone is experiencing urinary frequency. So making really frequent trips to the bathroom. The goal of this is to just return the person to a more normal and convenient pattern of urinating. And it also helps to restore the bladder capacity to normal. This typically involves just kind of following a set schedule. So sometimes patients will even just set an alarm. Okay, every 2 hours, I'm going to the bathroom to empty. Sometimes it has to start even shorter than that if they're going really frequently. Um, Urge suppression strategies are meant to be utilized when a person has that strong sense of urgency and feels like they can't make it to the bathroom in time. So these are kind of the steps. So the first step is to stop moving and sit down if able. Kind of leaning forward and placing pressure kind of on the pelvic area can help to inhibit the urge. Using distraction techniques such as deep breathing, counting backwards, positive self-talk can be helpful. Um, you can even think about trying to contract your pelvic floor muscles, which I usually cue people, just think of stopping the flow of urine. Um, that can help to suppress the urge. And then kind of the biggest thing is after you've gone through all those things, just calmly walking to the bathroom if you still have to go. Don't let your brain get in control of your bladder. Don't rush to the bathroom. All right. Now we're kind of shifting gears to constipation. So constipation is considered having a bowel movement less than 3 times a week, or having difficulty emptying your bowels. So having to strain, push, or having frequent incomplete bowel movements. Stroke by itself does not cause constipation, but it often occurs after a stroke due to not drinking enough fluids, being less mobile, or taking certain meds. Those can also cause constipation. Um, Constipation can also have several effects on the bladder. So when the rectum is full of stool, it can put pressure on the bladder and may increase urgency, frequency, or even leakage as well. So what do we do for constipation? Again, pelvic health therapy is first on my list. Um, we will kind of focus on retraining of the pelvic floor and abdominal muscles because they are involved in having bowel movements. And then we may teach, we likely will teach self-management strategies. These include just eating habits, proper fiber intake. Should I admit him in here? Yeah. Okay. Oh, he's already in. Okay. Proper fiber intake, adequate fluid intake, exercise, toilet positioning or posture, like just the positioning you have while you're attempting to have a bowel movement. And then sometimes we'll teach abdominal massage. Medications will sometimes include stool softeners or laxatives, and those should be managed by a physician. All right, so there are certain foods and beverages that can irritate the bladder. Um, And an irritated bladder often signals the need to be emptied more frequently. So, and it may increase that urgency piece too. So here's a list of fluids and foods that can affect bladder irritability and leakage. These include caffeinated drinks, including coffee and tea, soda or carbonated drinks, even just strict carbonated water, like bubbly water, even if it's not caffeinated. Alcohol, artificial sweeteners, citrus fruits and juices, acidic foods, so like tomato-based products, vinegars, those types of things, and then spicy foods. Um, I often find that working with patients to reduce or remove these foods or drinks can really help very early on. They even find that doing so can improve bladder control and bring relief within 10 days. So these really do make a big difference. And I think when I first tell people about them, they're a little unsure, but then once they actually give it a try, they're like, I don't really want to stop drinking all that coffee. But once they actually do, it really does help. So, like I've been saying, water is best. Water should be the majority of what we drink every day. And oftentimes, people who are having bladder problems or leakage will often reduce their fluid intake, hoping that the need to urinate will be less. But as a result, the urine actually becomes more concentrated and can cause you to have more frequency and urgency. So, staying hydrated is key. So, that brings me to, do I drink enough? And how much should I drink? I thought these water bottles were kind of fun. I don't have one myself, but it just seemed kind of motivating. So it is recommended to drink 6 to 8 8-ounce glasses or 48 to 64 ounces of fluids throughout the day. And at least 75% of that should be water. And then caffeinated drinks, including coffee, do not count towards that daily intake of 48 to 64 ounces because they tend to dehydrate the body. There are some sources out there too that recommend drinking half of your body weight in ounces of water. I think sometimes that can be unrealistic and kind of mind blowing for patients. So I typically will recommend that 48 to 64 ounces. All right. So I thought this slide was just kind of helpful to just know some bladder norms and just some tidbits about the bladder. So, the bladder holds about 2 cups of urine before it needs to be emptied. And we'll typically kind of get that first urge to urinate once it's about half full. So, once there's about 1 cup in the bladder. But we should be able to just kind of let that urge pass, knowing, okay, there's more space to be filled. Um, the bladder needs to be emptied about 5 to 8 times a day. This equates to about every 2 to 4 hours. The urine stream should generally flow easily without discomfort. And then I really like to share this, that the bladder urge is a signal, not a command. It's a signal that the bladder is stretching to fill with urine. But the urge may even be felt if the bladder is not full. So we typically get that urge like when it's half full. Um, so it's not a command to go to the toilet. It's just a signal that should be controlled. So here are some good bladder habits to kind of take away. So this first one I think is really important, and avoiding going to the bathroom just in case. I think it's something I know I was taught as a kid. Well, you better go before we get in the car or before we, do anything. Go to the bathroom. But generally, it's not necessary to empty your bladder when you first feel that urge. You should really only go when your bladder is full. So urinating just in case can often lead to increased frequency and urgency. So if we're going just in case frequently throughout our day, we're just going to really almost kind of shorten that interval. So then frequency becomes more of an issue. Um, but then again, on the other end, it's also important to not wait longer than 4 hours between voids. So that can also obviously increase those symptoms. Avoiding straining or pushing to empty the bladder, staying hydrated, that 48 to 64 ounces of fluids, limiting bladder irritants, and then keeping bowel movements regular is also important. And then lastly, here is just an example of, I give this out to patients typically on their first visit. We call this a bladder diary. Um, I'll often have a patient fill it out for at least 2 days after our initial consult. It's a tool that just really helps us kind of better understand what's going on from a bladder and bowel standpoint. It helps to guide treatment by telling us how often is someone urinating, how often are they having urgency or leakage, how much volume they're urinating, and then what and how much they're drinking. Um, Patients often find this very helpful and will notice just by bringing awareness to it and tracking these things helps their symptoms significantly. I think people often are surprised by, oh, I thought I was going to the bathroom more frequently or less frequently, or I thought I was drinking way more than I am. So I think it helps to just bring more awareness to the issues. I think That was my last slide. Any questions at all?